Good morning. Thanks to those who have joined already. I've got quite a lot of registrations this morning. I'd be very grateful if somebody, of course, if you can hear me, could let me know you can hear me by posting in the chat. Yay, thank you, Abby. And you can see the first slide, Basic UDI-DI Global Model Number. You can see the first slide. Thank you. Excellent, thank you. Great, I've got thumbs up. Okay, fantastic. Okay, good to see so many of you joining on time. Just give it another minute or so. Righty-ho. Chat. Still got a few more people um, joining. Malcolm, you've got your hand up. If you unmute, you can ask, let me know. Hi, Malcolm. I can't hear you, Malcolm, if you are talking. Okay, perhaps if you've got a question, you could put it in the chat or in the Q&A. Okay, let's get started. We've got quite a lot of people who have already joined us. It's a bit of housekeeping before we actually get into the session itself. The session is being recorded, and I will be sharing a PDF copy of the slides with you all shortly afterwards. Now, today's session is about the basic UDI-DI, which within the GS1 world is called the Global Model Number. Um, and as I said, you're all on mute. Put your hand up in the chats or Q&A, and I've got them all open. Um, if you've got any questions, any queries as we're going through. But I'd like you to indulge me for a few moments first because we've got our GS1 UK Healthcare Conference coming up at the end of this month. I've spoken to many of you that are on this call about this in person. Just want to take this opportunity to, for those that registered late or haven't spoken to us yet, just give you some details about the GS1 UK Healthcare Conference. Should only take a few minutes. This is happening at the end of this month, so we're less than 4 weeks away. So you can imagine got a lot to do. We're at the QE2 Centre in Westminster in London, and we have event partners that BIP Solutions that are organised have organised other healthcare conferences, such as P4H and HCSA. As you expect for a conference, the format is plenaries, breakouts, and exhibition, and networking opportunities, with a focus primarily on the UK. Networking events, Tuesday, 29th of April, which is day one. There's an evening's drinks reception sponsored by Advise Inc., who do a lot of work around data with NHS organisations. And on the Wednesday afternoon, for those that get in quickly, there's a few more spaces available. Afternoon tea at the House of Lords. Um, right, plenary sessions, strategic-based national and international topic coverage, focus on the GS1 UK 5 asks of government. I'll come to those very shortly. Updates from key programs from NHS supply chain, Department of Health, and new hospital programs, and of course, patient safety and international scan for safety stories. So the 5 asks of GS1 UK for the government is for a single national patient identifier, so that, across the UK, there's one system for patient identification, that all trusts have an electronic patient record system that can identify and use GS1 standards, such as those for the barcode on the wristband, ensure the delivery of a national product information master for medical devices. So suppliers can put all their information, manufacturers put all their information into the MHRA registration system, and that then feeds through to that product information management system, and that then feeds into your customers. And that will then feed the inventory management systems, because we'd like to see an inventory management system in every trust that scans GS1 barcodes, and that the new hospital program embeds GS1 standards at the beginning. So quite big asks of government around GS1 standards. Some keynote speakers to mention. MHRA, the Healthcare Services Safety Investigation Body. We've got the Patient Safety Commissioner, got NHS Supply Chain, the President of NHS the Chair of NHS Providers and GS1 UK's President. So lots of keynote speakers who are in strategic positions within the NHS and the Department of Health. Key themes, if you know anything about GS1 and Scan for Safety, it's very much about people, product, place, but this one is about people, product, place, process. So this is people, patient safety and interoperability, product traceability and sustainability, location identification and efficiency for place, and process engagement and implementation. And of course, product traceability and sustainability is the focus for medical device manufacturers. And I've picked out some sessions that may be of interest to you as manufacturers. So a panel discussion on unique product identification, particularly connecting the dots between national programs, so that the GS1 standards that you use can be scanned to inform things like the outcomes registries. A panel discussion around a unified approach for Scan for Safety across the UK and Ireland. And so that's Ireland as in Southern Ireland, Republic of Ireland. The impact of accurate product identification, and this is looking very much at things like the PIM and the NHS Inventory Management System point of care scanning program, and looking at inventory management point of care scanning, look at a trust in England and across the NHS in Scotland. And finally, driving product sustainability. 3 manufacturers and are talking about how they use GS1 standards to drive product sustainability. Okay, that is it from me. So thank you for indulging me for those few minutes. I'll leave that there for a few moments. So scan with your phone. We'll all use QR codes these days. Go ahead and scan with your phone, and you can register. But the link to this will be shared afterwards as well. So thank you very much. Any questions on the conference or anything you've heard so far before we move on? I say thank you for indulging me. So let's move on then. So you're here for me to talk about the basic UDI-DI, which, as I said at the beginning of the call, is met. The requirement for that is met using the GS1 Global Model Number. In the same way as the requirement for the unique device identifier, the UDI-DI. The UDI-DI is met by the GTIN using GS1 standards. The basic UDI-DI is met by the GMN, the Global Model Number. Keep it up there for a moment, but basically it says that we're not regulatory experts. GS1 is not we're not regulatory experts. We have a lot of I have a lot of experience of talking to our members about the regulations, and I can pinpoint you to areas within the regulations and what they say, and I can provide you with my knowledge and experience of talking to other members and talking to MHRA and talking to other GS1 membership organisations, and but ultimately it's down to you to make sure you get the right advice to implement the regulations. So within UDI-DI, there are 6 modules, and the one we're going to focus on is electronic system on UDI. Now, within that electronic system on UDI module, there is an identifier that links all of these 6 modules. So within the Global Unique Device Identifier database for the FDA in the US, it is all about the product's static data, a little bit about the manufacturer and the unique device identifier, the GTIN. But within this system, you've got 6 modules. So how do I get from one module to another? Well, they're all linked by a single code, a single identifier. And that single identifier is the basic UDI-DI. It's the main key in a database and relevant documentation to connect devices with the same intended purpose, risk class, and essential design and manufacturing characteristics. Remembering that it's independent from the packaging of the device and it does not appear on the device or its packaging. I'll pause for a moment. It's just me checking the Q&A in the chat. I'm glad to say we had some questions submitted upon registration as well. So it's neither basic nor a UDI. So it serves a regulatory purpose. It doesn't serve as a traceability purpose, unlike your GTIN. It's a primary identifier device model. And as I said, it connects devices with the same intended purpose, risk class, and essential design and manufacturing characteristics. It's the main record key in the UDI database. So all of those 6 modules are all connected by the basic UDI-DI. So somebody coming to that, member of the public or a hospital or clinician coming to UDI-Med with that basic UDI-DI, they enter that and it opens up all of this information for them. It's referenced in regulatory documents, so expectation is that you'll put it in things like your declaration of conformity. And again, remembering that it's independent from labeling. So in the same way as it's not your GTIN, it doesn't have to appear on your product or your packaging labels. So here's a graphical representation of the basic UDI-DI linking to different GTINs for the same product in different packaging counts. So this is just one item, but you'd have 3 different GTINs for that same item for different packaging levels. They would all be under that same basic UDI-DI. And if you had another product that met those criteria of same risk class, same intended purpose, same essential design and manufacturing characteristics, they would also go into that group under that same basic UDI-DI. And here we have another representation of that. So you've got a syringe, and the syringes all have the same intended purpose, risk class, and essential design and manufacturing characteristics, but they're different sizes, and there are different counts of those different sizes. So they're all under the same declaration of conformity, and so they have the same basic UDI-DI. And the rule of thumb, it's not a hard and fast rule, but the rule of thumb is that it's one basic UDI-DI per declaration of conformity. There are some exceptions, but that's a basic rule of thumb. And the global model number, like all GS1 identification keys, has a set format, and they all start with a GS1 company prefix. So the start of your GS1 company prefix is position 1 in the global model number. And that GS1 company prefix from varying length. It's normally 7, 8, or 9 digits long. On some occasions, it could be 10 or 11 digits long. But it's mostly 7, 8, or 9 digits long. And then we have a model in the middle. We have a model reference element, or your internal number, and that is for you to decide on. That's for you to decide upon. And we'll come on to that in a bit more detail in a moment. And then there's the check character pair. Now, the length of the global model number is a maximum of 25 characters, including the check character pair. So let me just take a moment to switch screens. I'm going to stop sharing and I'm going to start sharing again. And hopefully I've still got it open in the right place. Okay, it's here somewhere. Well, there it is. Okay. So this is the check character calculator or the GMN generator. Okay, and we enter a GS1 company prefix. So I'm just going to enter one of ours, 50123445. And then I'm going to enter an internal number or model reference element. And this can be anything. I suggest not using things like brand names because you might have more than one brand in a DOC. I'm not a regulatory expert, but don't use descriptions of the product. I would use something really simple. I mean, something like A000 and then click calculate. And the reason I've put in alpha characters as well as numeric characters is with the alpha characters, you know this, if you only put numeric characters in, the check character pair might end up being 2 numeric characters, and you could end up then with a basic UDI-DI that looks very much like a GTIN, and that can cause confusion. You know, if it's got alpha characters in it, that you will it's definitely not a GTIN. And I'm pleased to say that I've actually seen basic UDI-DIs in UDIMED already that have that internal number or model reference format. So people take notice. Great. And then they say you then just press calculate. The validate button only becomes live once you've actually put in the check character pair. So that is used to validate a full basic UDI-DI just to check that it's actually correct. I click validate, and of course it tells me it's correct. If I were to put in 2Z and click validate, the check characters are wrong. The other thing to note is that the check character pair is case sensitive. So if I put in AAA and click calculate, you get a different check character pair. That's really important. Okay, there's no questions on that, so I'm going to move back to the slide deck. Okay, that was pretty seamless. Hopefully. Hopefully you can see the global model number on there now, and you can see that the person that put this slide together is an Aston Villa fan. I'm not sure if he's going to be going to Wembley later this for the semi-final, FA Cup semi-final, but okay, so creating the basic UDI-DI. When creating the basic UDI, it's important to consider avoiding using product names or brand names. The check character pair is case sensitive. Use alpha characters in model reference. Unless model reference is already assigned to the product groups, keep it simple. For instance, the range AAA000 to AAA999 gives you 1,000 basic UDI-DIs without having to make any change. And I think, yeah, 1,000 basic UDI-DIs is a lot. Add the nomenclature to your standard operating procedures. What it basically means is if you're going to use AAA000 to AAA999 or whatever you use in terms of the format for that model reference element, add it to your SOPs so you don't end up with situations where people use lower cases and get different check character pairs. And many notified bodies, NBs, are actually asking for the basic UDI-DI even before the actual GTINs are assigned. Although, given the timelines, I'm hoping that most people have got their GTINs assigned already. I'll pop back out the chat. I'm going to pop out back out the Q&A just so I can keep an eye on those. Okay, so triggers for the new basic UDI-DI. So UDIMED has built-in triggers when making database changes, and a change of UDI does not, of GTIN does not automatically trigger new basic UDI-DI. I'm not going to go into too much detail on these, but I will share the slides. Is with them always regulations trump the GS1 healthcare GTIN allocation rules and the GS1 gen specs. There are links to some documents which actually show the triggers for new UDI-DIs, GTINs, and new basic UDI-DIs for both medical devices and IVDs. And there's also MedTech Europe guidance for assigning basic UDI-DIs. Okay. Well, important to remember that there may be only one basic UDI-DI assigned to multiple UDI-DIs at any time. Similarly, there could never be multiple buddy DIs linked to just one GTIN. And it's crucial to understand as a buddy DI cannot be changed. If you change it, it necessitate changes to all the if you change the basic UDI-DI, you change all the GTINs. Okay, so I'm not going to go into too much detail about that. So let you read that for yourselves and look at the links. But some FAQs from, I think this is probably the 25th time I've done this, and we still get lots of people joining, which I'm glad to say. Do I need to register my basic UDI-DIs with GS1? No, you don't. And another thing to remember is when you use that check character pair calculator, it's literally just an online calculator. It's not saved anywhere, it doesn't get sent anywhere. It's literally just a simple calculator. And what it doesn't validate is that you've used the right prefix. Really important that you make sure you check you're using the right prefix. Doesn't validate that. That validate button only validates that the check character pair is correct. Can you manage your basic UDI-DIs in My GS1? So GS1 UK members have access to My GS1 where your number bank is. You can't yet manage your basic UDI-DIs in there. And do I need to add my basic UDI-DIs to my packaging labels? No, you don't. Okay, thank you, Karen. It's just taking my attention. Yes, I'll come to that in a moment. Thank you, Karen. So before we go on to questions from the audience today, let's go answer some of the questions that were asked upon registration. What are the deadlines for putting your barcodes on your products? Well, here they are. So you've got until if you haven't done so already, you've got until the end of pretty much the end of May this year to make sure you've got a GTIN and a barcode, and that's on the product at the appropriate packaging levels. For IVD, it's actually by the towards the end of May 2027. So what is UDI? The question that was asked was not about UDI, about basic UDI-DI, but it was about UDI-PI, UDI-DI, and UDI-PI. So I'm just going to show you what the difference is. So the UDI-DI is the mandatory fixed element, i.e. the GTIN. And the UDI-PI is a conditional variable element, such as manufacturing date, expiry date, lot number, serial number, and for software as a medical device, it'll be software version. So UDI equals UDI-DI plus UDI-PI, and there's a GTIN using O1 as the application identifier for the GTIN field, and then we have the rest of the information using application identifiers 11 for production date, 17 for expiry date, 10 for batch, 21 for serial, and 8012 for version. There's also another question around how the data should be represented on the label. And essentially, do I need, if I've got, for instance, the information next to that's encapsulated in a barcode next to the ISO symbols like lot and manufacturing expiry, do I need to repeat them next to the barcode? No, you don't. What we do ask is where you have the things like the date and the lot in the barcode, that where appropriate, you also include the application identifier. So an example on the left, you've got one there where you've got O1 and 10 for GSIN and lot number next to the actual values, and those are actually captured in the barcode. The date format in the barcode is always year, month, day. So the date format here is not showing in that format, so you shouldn't print the application identifiers next to them. And on the bottom right, you've got another example where on the horizontal, they've put the different data labels and symbols, and they've put all of the application identifiers next to those. So they've actually used both, which is fine. And the reason I put the other one on the top right on there is because that is another label, small label, where the GS1 data matrix is less than 6 mil by 6 mil, and that captures 4 different data elements, and it's printed to a quality, even though that's that small, that creates an A grade when using a verifier. That was just to demonstrate that. Okay. And the last one was about procedure packs. And this is pretty much all I can say about procedure packs. It pretty much follows the rules for any other product. You need to understand what a procedure pack is, but they should actually be assigned and bear their own UDI. I'm happy to take have a more detailed discussion about that offline. Um, Essentially, the rules are the same. So, questions in the from the call. Just, okay, very quick. Do you know what the process for updating the risk class of a basic UDI-DI? Well, if the risk class of a product changes, it needs a new basic UDI-DI. Because the three things that have to be in common that connect the products in that group are the same risk class, the same intended purpose, and the same basic design, essential design and manufacturing characteristics. So if you've got 10 products in that group, and the risk class of one of those products in that group changes, it's no longer a member of that group. It needs to be in a different group. If you're starting a new group for that product because of a different risk class, it needs a new basic UDI-DI. Okay, I recently encountered an issue with a regulator regarding our UDI formatting. According to GS1 standards, do you think it is required that the full UDI be presented on a single line, or is it acceptable the A identifier be separate from corresponding number? We have placed symbols next to numbers with the A identifier position below the symbol rather than okay, great. Thank you, Stephanie. If you can email me with images of those, and we can then have an offline discussion about that. So I'll just get. Is that okay? I've just realised we've actually coming towards the end of our half an hour. I don't have a hard stop. So if anybody else wants to continue and has any more questions, then I'm happy to carry on. Otherwise, as I can see, people are now dropping off. Otherwise, because they obviously do have hard stops. Otherwise, thank you very much for joining. As always, hope you found this useful. and I will be sending you out a PDF copy of the slides and a link to the recording of today's session afterwards. So I'll sit here for a couple of moments, but for those that you are leaving now, thank you very much. Have a good afternoon, and hopefully I'll see you at the conference. Thanks a lot, guys. Stephanie, I'm just putting my email address in the chat. And Mark, regards to the government, is that the UK government website? Um, because the I'm talking specifically about the EU in terms of timelines for the EU, because we're talking about the basic UDI-DI, which is a currently a European requirement. There are no regulations around UDI in the UK at the moment. Um, but we're hoping, hoping, we keep hoping that something's going to come out around this very soon. We're hoping in time for our conference at the end of April, end of this month, at least some notification. Um, so we have created, thanks, Ennis. We have created the basic UDI-DI and our production related information is ready now. We would like to generate UDI-DI through GS1 and see it in label format. What steps should we follow to do this? Okay, so when capturing both the UDI-DI and the UDI-PI in a barcode, you need a GS1 one-to-8 linear barcode or a GS1 data matrix barcode. And neither of those can be created from your GS1 UK online account. Let's get back in touch, Ennis, and we can set up a call and I can show you how you go about creating those particular barcodes that capture both the full UDI. Thanks, Ennis. Is that going to answer your question, Mark? I think so. No, in terms of the EU regulations, there has been some delay in certain aspects, and the deadline for certain things has been changed. But my understanding is the deadline for actually putting the barcodes onto medical devices, that is the end of next month. You actually putting your data into Udamed, that's been delayed. There's a playground you can play around with at the moment, but the actual mandate for that is not expected until 2029, in fact. So hopefully I just double check, is there actually anybody still on the call? There is. Great, excellent. Let's talk to self. Okay, anything else before we finally finish? Thank you very much for sticking around. Okay, so okay. Thank you very much. I'll finish the call then. Have a good afternoon, guys.